Getting things ready. Now we're off, on. All right, cool. And then we turn this guy on. Good morning, Joso. How are you? Hey, Alice. Thank you so much, Chunky. I will do my best. How are all of you doing this fine day for you all, and this way too early in the morning for me? I saw that, Alice. I'm super stoked. Yeah, super stoked. Yeah. You're in your hiding under rocks phase. That's all good. You can hide under rocks, and you can just put those rocks in our little neighborhood and still hang out. Yeah. Feeling pretty salty? What's going on, dude? Is it just stuff with the boyfriend? Not just, but you know what I mean. Because ain't nothing just. There we go. My morning so far has been just trying to wake up, you know. Saeem, how's it going? Sort of. Therapy tomorrow has me worried and snappy all morning. Hey, well, therapy, it's going to be the first, right? And it's going to be a safe place to open up and to hopefully be opened up to, you know, and a lot of it can be nerves too, you know, of just that moment coming, you know. So, my brother in Christ, give yourself some grace, right? that just came off way too religious, but you know what I mean. Give yourself some grace, because you know, I would be nervous too about that, you know, nervous about yeah, overwhelming. A lot. It's a lot, you know, because there's a lot that has led up to this. It's a big thing, you know. Had coffee and donut for breakfast. Awesome. I'm about to pop open my breakfast right now. So, not that I'm advertising, but it will give me wings, but sugar-free, because I don't need that extra sugar, that's for sure. But I also chipped my tooth yesterday, and so I am going to be carefully drinking this. Actually, I should probably do it through a straw, to be honest. Hold on a second. All right. Hey, Jennifer, how's it going? Kind of focus on putting things down on paper. Things I want to say, it's like I can't access those emotions anymore. Yeah, you're numb. Hey, Alicia. You know, I get it. Good, Jennifer, good. You know, it's especially when you've been thinking them over and over, I would just say, you know, do take notes, but like you don't have to write everything down. Just like make bullet points, you know, so that you know what you want to bring up. Chunky, thank you for the heart me, and Alicia, thank you for the heart me. Appreciate you both. Appreciate everyone here. Thank you for the roses as well. Victoria, how's it going? We got Mama Rex is here also. Heather, hello. Got to yep. But yeah, Joso, you know. Wait, I even snapped at Gabe earlier because it felt like I was talking to a wall. Yeah, you know, with Gabe, I mean, I think a lot of people know, but a lot of people don't know that he is very likely bipolar, but is at least having those bipolar symptoms, high highs and low lows. And his high is usually when he talks about being a god and stuff. Yeah, you know, it's rough. It's rough for him. Hey, Gnome, how's it going? Hey, Kelsey. And so, you know, it's been rough for him, and I want to give him that space, you know. Oh, you went past it, Gnome. You went past it. 74. Still appreciate you. It's like 69 with 6 extra or 5 extra, right? I appreciate you so much. Refusal to take advice is what bothers me. Yeah, but the thing is like at the high highs, you already know everything. You're the master at everything, you know. 1K off to work I go. Thank you so much. Was that all you? Now I gotta look. I gotta look and see. Did we get all of that? Well, a whole bunch of it. Thank you so much, Junkie. I really appreciate that. Oops. Turn on, turn off. Computer's a little slow. I have OCD intrusive thoughts. Well, welcome in, Brooke. I don't know much about OCD, but this is a safe place, especially for, you know, that type of stuff. Can I be honest with my therapist? Absolutely. Please, please, please do. Okay. Be completely open. Have, you know, of course, as much as you can be. I know a lot of it has to do with your comfort and your ability to be able to, you know, open up and feel comfortable doing it. But the more you can open up, the more honest you can be, the better everything will be, you know. And if it's too much for that person, hopefully they tell you, you know. Yeah, Brooke, I know. Getting scared is normal. But that's part of being vulnerable, is that it's scary. Being vulnerable is scary. Okay. I make it look easy up here. And part of that is fueled by a desire to just not be where I am. So that pushes me. But it is hard, you know. And so allow yourself to know that it's hard. Yeah, I was getting agitated, so I didn't. So I stopped interacting. I honestly didn't want to hurt him in any way. Yeah, Joe. So that's the same way I feel too, you know. But yeah, I think a lot of people don't know that he has those high highs and those low lows, and I want to give him a place to be able to not feel terrible about how he feels after he comes off of the very high highs and gets back down to a low. Because he feels really guilty. He really, really, really beats himself up over it. And so I need to figure out a way, though, on Discord to allow him to do that, to where it doesn't, like, you know, impact other people as well. Because I don't want him to have to then set himself up for doing a lot more apologizing and all that stuff, you know. So if you were in the Discord last night, you'll know what I was talking about, you know, with Gabe. He's going through some stuff. And yeah, just a lot of very high highs and very low lows. But he's in therapy and getting there, and hopefully on the road to being able to stabilize. Hello, Saeem. Just check my blood pressure and it is high. What should I do? I don't know. I'm not a doctor. But I would say do some deep breathing. That's what I do when my blood pressure is high. I just try and calm myself. Um, deep breathing, slow the body down, take control over your body by breathing, because that is a thing you can control, and everything else has to follow suit. So what I personally do is box breathing, just because it's easy to remember, which is 4 seconds inhale, 4 seconds inhale, hold for 4 seconds, and then 4 seconds exhale, and then you wait for 4 seconds, and then you repeat over and over. Just make sure that you're doing the holding in, and that you're doing everything paced. And if it's all off at first, that's totally fine. Just try and get to a 4 second, breathe, 4 second hold, 4 second exhale, and a 4 second pause. Let's see. Makes me panic and puts me in anxiety. Yeah. I get that. Oh my gosh, what is happening here? Sorry about that. I have to over talk all these things because I have no idea what the heck they are and what they're gonna spout out. Yeah. Let me see. How do you get rid of your thoughts? You can't really get rid of them per se, but you can manage them. Noam, thank you for the heart me. Kelsey, thank you for the heart me and go popular as well. And Noam, thank you for the go popular. And Zena, thank you for the relaxed goose. The relaxed goose. Thank you so much for that. I really appreciate that. Yeah. Let me look up here. Yeah, getting rid of thoughts is really, really hard. I think really one of the things that you can do, is start to, there's a few DBT skills that can help specifically with thoughts and help with, kind of checking into them. And so for those of you who don't know, like, one of the things that really, really, really helped me when I was going through all of this was dialectical behavioral therapy, and learning all the skills that came from that. And a lot of times, for me, things that would help was one of the skills called putting your thoughts on trial. Okay, and essentially what that does is you put, if I recall correctly, because it's been a while, you list out, sort of the, I guess the truths, for the things that you are, the thoughts that you are thinking about, right? The positive thoughts, the negative thoughts, or the positive truths, the negative truths, all that kind of stuff. But you put the things in there that basically the verified facts, and you allow for them to exist. And Desiree sending a galaxy. Oh my goodness, Desiree, I appreciate you, and good morning to you. Did you just reach level 31? Is that for reals, or is that a blip? That's got to be a blip. 13. Why did it get backwards? Is it 13 or 31? I don't even know. I can't tell. But anyway, thank you so much. But yeah, look into putting your thoughts on trial on YouTube. I'm sure there'll be a better explanation there than what I can get into. But yeah, for reals. I think it's nice that there's a space for him. We can give him some grace. Absolutely, Alice. That's what I was saying too. Is that, it's good to give that space to anyone, and that means we may see a lot of weird stuff, right, or things that we don't understand. But that's where we give grace. And I think at this time, Gabe needs a lot of that, he's going through a lot, and this is like a huge thing for him that he's very aware of. And those high highs and those low lows is, it's really hard for him. But yeah, Brooke, definitely try and open up and, just be as comfortable as you can be. I know you got this. Hello, I also have CPTSD as well. Wish you the best. Lots of love from Norway. Thank you so much, Zena. I really appreciate that. Yeah, and of course, come here, be here. This is community. This is people who understand this stuff. And even if we don't understand, we know what it's like to not be understood. And so, it's a good place for that type of grace that we need. So yeah. Hey, old wise one. Really, Desiree? Really? I am not old. And the wise part, we can kind of put that, put that on trial as well. What wisdom does he bestow upon I? Oh, I don't even know how to respond. First question is, how high is your blood pressure? Yeah, I'm not like a doctor though, so I feel really cautious about responding. Be safe, everyone. Lots of luck with everything you have today. Treat yourselves to something. There you go. Whoa! Chirpy kisses. Thank you, Desiree. So rather than PTSD, you say you had post-traumatic growth. I have had some growth from the PTSD, but at the same time, it is stress from trauma that goes into like my nervous system. Care to go into the events causing the trauma? Childhood abuse, a child abuse in my childhood, severe, extreme corporal punishment, thousands of times, with a bunch of other junk in it, and psychological things as well. So, yep, it does a lot to a kid that doesn't understand emotions. Do you recommend meds or natural? Well, for me, meds are what I want. For everyone, they need to kind of discuss on their, with their practitioners. They need to make that decision on their own, because I'm okay with, with meds. A lot of people aren't, so yeah, it's really up to the person. I'm sorry if I missed any comments. Things are just like kind of flowing by really fast now. So if I did miss anything that needs to be responded to, feel free to resend it and I will get to it. But yeah, see, I figured I could help, but when I saw I couldn't, I got angry with myself. Yeah, okay. I'm trying to get back to Joseph, what you were talking about, what you were struggling with. Because I know that there's stuff there. Hey, Anne. Good morning, honey bae. Gotta scroll up. Gotta find Joseph's comments. Yeah, accessing those. Yeah, bullet point. Your voice is so calming. How often do you go live? Thank you for the rose, Desiree. I go live every morning at 6 a.m. and this is my morning voice. It's also my evening voice though too sometimes. Well, I don't know. I think in the evenings I'm probably a little bit more up and awake, so probably much more sarcastic-y. Although that kind of follows me all the time anyway. I have let me see. I have ADHD, autism, ADHD, autism, complex PTSD. How is it possible to manage? It's a very challenging thing because a lot of these things, they play around with each other, and it's very, very challenging. But honestly, start with therapy, because having those things itself is going to be very challenging, and so yeah, and give yourself some grace as well, a nice healthy dose of it, because you're going through a lot. Suzanne, I have ADHD, CPTSD, and pretty sure I'm autistic too, because I show many traits. How did you find your way through it all? Well, when I first was recognized all this stuff, it did all happen at once when I hit burnout. Because all my coping mechanisms, the things that I did to kind of hide it from myself all these years and hide it from everyone else, all those coping mechanisms dropped when I hit burnout, and I was just exposed to like raw symptoms of ADHD and autism and all that stuff. It was a huge mess. At first, I thought all of it was just ADHD because I couldn't only see the ADHD stuff. But as I peeled away everything and started to work on stuff, more and more, autism things were popping up more and more. Trauma responses and stuff were popping up. And so I was just dealing with things one at a time, to be honest with you. I was having difficulty remembering stuff when I was walking into rooms. And so I started writing a lot of stuff down, realizing I really should be writing stuff down, and started going through a lot of that stuff. And then when it came to trauma, I started therapy like 3 days later after all of this happened, and been with the same therapist since. She's amazing, and it's just diving into the trauma, and thankfully my therapist is also neurodivergent, so really helped me, sort through the realizations of everything, and understood sort of the impact that it had on me, having recognized this so later on in life, because it messes with your brain. You start to think, you start to realize how often this had come up in your life, and you lose your sense of self. It gets so challenging, but able to work through it. I got that amount of help, because I went to therapy, and I was so desperate to get through it that I had no problems telling my therapist every crazy thing that was happening without like the fear of judgment, because I was so scared, very, very scared, because of just everything happening at once. And so because of that, and because in between therapy sessions, I was also trying to work on stuff and trying to, come back with things, I kept continuing to work even beyond those therapy sessions. Just again, really, really desperate to get through it, but yeah, find a therapist. That for me was like the number one thing. Thankfully this time tomorrow I'll be in session, but I'll most likely miss your life, Joso. You can always catch up on it on YouTube if you want, because I'll have it there. But where you're gonna be is gonna be far more important. So if we gotta hang out later, we'll hang out later. But yeah. Good morning, baby. How are you? Just check my blood pressure again. It's much better, within range. 114/55. Yeah, mine's usually pretty high. Like in the 130s to 140s over. I don't know the other ones, but they're both, off. So, yeah. A lot of it too, I feel like, is, I have POTS, and one of the things that comes with POTS is a lot of holding your breath, right? And I do a lot of that breath holding, and especially for some reason whenever I get my blood pressure taken. And so I'll sit there and without even knowing, just start holding my breath while they're doing that. And it's like, well, that's increasing my blood pressure. So I have to do a lot of like reminding myself to breathe when I'm having my blood pressure checked and everything. Yeah. Usually they have to take it a couple times. Yeah. You have a cat, Jennifer? Do you think that your cat is affecting your blood pressure in a negative way or a positive way? It would probably affect mine in a negative way because of allergies and getting scratched. But yeah. Can stressors affect blood pressure? Absolutely. Absolutely. My goodness. Especially if you're carrying them in your body, you know, positive, good, good, Jennifer, good. Then yeah, reach out for that cat, even if the cat wants nothing to do with you because they're so mean. But yeah, stressors can absolutely affect you, especially if you're holding on to them and you're allowing them to consume you, ruminating on them, all that stuff. Because you'll just be focusing on them, and paying less attention to the present in your body right now and all that stuff. That's good. I'm glad that your cat is sweet. I haven't met too many that are, but I'm glad that yours is one of them. I have met some. So yeah. Diagnosed bipolar during a religious psychosis. Since then, I've stayed to myself, embarrassed a lot. You really should stay here. There's people in the community dealing with the same stuff that you are and feeling the same way that you feel. So Rebe Rebel, welcome in. And I know that this stuff is difficult and challenging, but and even with one of the people in here who's dealing with the same stuff, feels so terrible after the highs, whenever they feel like they have to apologize for stuff. And I don't see it that way. I see someone who's struggling and they're struggling out loud in front of everyone, which isn't something to be ashamed of. I do the same thing, and I don't have those, the bipolar. I'm not struggling with bipolar, but I'm struggling with a lot of other things. And, I think one of the things that we need to do, even if it's unnerving for other people, is to show the real face of these things and these struggles. I know for you, though, it's unnerving, it's embarrassing, it's not something that you want a representation of yourself to be, you know? Um, and so it can be hard, it can be a challenge. Um, but isolating yourself and keeping yourself away from people's only going to make things worse, because you need community, you need people there to be able to talk to, you need to not feel alone, and so I really hope you stick around, and yeah, just don't be afraid to just be your authentic self. Thank you for the follow. Because your authentic self needs to be known, and authentic selves also mean the things that we're struggling with, the things that we are going through. And I felt very alone when all this stuff happened, and I didn't know that I wasn't alone, that who would go this long without realizing they have ADHD and all that stuff. I felt very alone, and I didn't know that there was a community out there of people who had late diagnoses of things, and was able to find them. But more importantly, grow this into, a community of people who are struggling with all different kinds of things that are difficult and challenging. And, we need to be there for each other, because society says, shut up about it. Don't talk about it, keep it to yourself. And that causes us to feel alone. It causes us to feel like we're the only ones in the world dealing with this stuff. So I think it's time that we push back against society and say, no, I'm tired of being alone. I'm tired of shutting up about this. And so welcome in, stay in. We all struggle out loud. Just because the struggle is different doesn't mean we can't listen. Absolutely, Alice. And that's the thing, is that, like, at the core of it all, I know that like the things that I deal with are not things that people are going to fully understand. Nobody's going to fully understand me. No matter how hard you think you get it or how much you think you get it, you're not going to be able to fully understand me. Okay? But the understanding that you have of the fact that you know people misunderstand you makes you a little bit more open to hearing what people have to say, you know, because you know what it's like, you know. And so, yeah. BPD has very similar symptoms. Yeah, because of the black and white thinking, yeah. But then also, yeah, the extreme sort of like changes in mood and everything. Yeah, there's definitely a lot that's there, that has some similarities. Um, we don't talk about it because we all don't talk about it. Yeah, that's why we got to start talking about it. But a lot of times it's been because you're not supposed to talk about it. I mean, look, I'll get trolled in here like every day by people who are saying, you don't have this, you know, you don't, you know, and are basically trying to invalidate you, trying to get you to shut up, you know. And so, yeah, you know, it's a challenge, but we fight back against that. We need to. Um, let's see. Sorry, I'm behind in comments. Neurodivergence is a blessing. Yeah, definitely being able to see the world in a different way and all that stuff, you know, can be a blessing. A lot of the things are very challenging at the same time too, you know. And I don't want to ignore the facts that go in both ways. You know, it is hard, you know, but it can be a blessing, you know. Oh, your cat. Oh, Jane Goodall. Who is? I can't remember who that is. His name sounds familiar, but face to the name isn't working right now. Started meds again for anxiety, and it helped fix my sleep schedule, and I'm dreaming again. Awesome. That's great. Having access to your dreams. I haven't. I mean, I've been. My dreams are kind of hard. I know that I have them to a certain degree. I just can't really tell what's happening, you know? So I feel like I'm slowly starting to get back to it, but yeah. Scientist, environmentalist. Okay. Sorry to distract from the seriousness, but where's your robe? I was actually thinking that I needed to put it on because I'm getting those chills all over my body. So yeah, putting it on. Then we can get back to the morning vibe. I heard DBT therapy helps a lot and group therapy. Absolutely it does. And so if you've ever been in here before, those of you who are here now, I talk a lot about DBT therapy, because dialectical behavioral therapy changed my life. It saved my life because I was at the lowest of the lows, not really understanding myself or the world, and this helped me reconnect with my body and helped me better understand myself and see myself, you know, in this world. And so, you know, DBT therapy, I would 120% encourage anyone to do DBT. And if you can't find a DBT therapist, or find a DBT therapy group, you can do self-therapy too. There's the dialectical behavioral therapy skills workbook that you can get on Amazon, and it goes through all the skills because it's a skills-based therapy, and you can really help yourself learn the types of things that can help you with especially the emotional dysregulation and all that stuff that comes through it. So yeah, definitely, looking into that. And yeah, it really did save me. Um, the ADHD is strong today. Reals. Um, uh, let's see. My chaos brain thanks you. You're welcome, Mama Rex. Found a way to eat better that I'd share when I get up in the morning. I cook dinner and then put it in the fridge for later. That's pretty ingenious, especially if that's one of the things that you struggle with. And see, that's the thing, is that this is what a lot of real helping yourself on with ADHD and stuff looks like. It's setting yourself up for success in whatever way you need, and looking through all these different things and finding solutions to this stuff, so this is what growth looks like, is not, hoping that a pill takes care of it, but it's helping yourself as well, working with your brain and not against it. And so, that's what a lot of it is finding things that work specifically for you. Is DBT therapy covered by state Medicaid? I'm not too sure. You might be able to like cross-reference and look people up and do all that kind of stuff. But yeah, CBT is another income. Yeah, CBT is okay for talk therapy and reframing and stuff. But a lot of times, especially if you've been through trauma, CBT therapy can be very invalidating because it's trying to change your reality, into looking at it a different way, but that way kind of being false, especially when it's trauma. And so, for me, it made me feel very invalidated. It made me feel very, actually, like not even seen. So it was putting me in like a really bad place. That's why DBT for me is the one that I would say, like, definitely look towards that. What was the book called? Sorry, I just jumped on. Yeah, it's the Dialectical Behavioral Therapy Skills Workbook. You can find it on Amazon if you want as well. So get your screenshots ready when I show it. Take a screenshot or something. So, but this is a book. It's on my showcase. If you wanted to see specifically what it is, doesn't mean you have to get it there. But I just put it there to put it there because I reference it a lot. But it's also available wherever you would, get books online. And if you search Google for DBT workbook PDF, it's uploaded there by a university. And so it's like one of the second results, just the green cover. And that, you can start looking through it today. But like I said, it's a skills-based therapy. So it teaches you skills and things that kind of help with a lot of that day-to-day stuff. And the PDF of the workbook tailored to ADHD. That's awesome. Yeah, put it on the Discord, Mama Rex. Yeah, when I get up, I'm like, okay, I need to human, then that runs out by lunchtime. Yeah. Of course. All right, Jennifer, have a good one. Have a good therapy appointment. Learning how to see things from different perspectives of mine helped me tremendously. Yeah, that's one of the things that really is kind of powerful, even with DBT, is the way that it allows you to be able to kind of look at things from different perspectives. And honestly, I needed that with my trauma because my stuff had to do with things that were done by my caretakers, and I couldn't just believe that my caretakers just hated me, that I was just targeted by them, right? If it was some other external factor outside of my family, I could just say that person's sick or, whatever, right? But these are the people who raised me. And so I had to have a better understanding, of this, to have a more rational, non-emotional thought as to why it would happen. And being able to look at things from different sort of perspectives did help, and sort of like these multiple truths that are there. But to where still accountability is where it needs to be, and that's one of the things that DBT really helped me out with. So yeah. But yeah, so how is everyone doing this morning? I think I ate too many peanuts last night. My stomach hurts. Way too much fiber. But yeah. So those of you who don't know, my name's Tim, and I did learn all these things on my 43rd birthday last year. Basically, after many years of wondering about my cognitive decline, I kind of narrowed down on it being ADHD. And then on that same night, when I narrowed down on that and kind of realized that's what it was, I had a bunch of repressed memories come back from my childhood, of tons and tons of violence and stuff that then overwhelmed me, and obviously made me feel very unnerved by everything. And when I woke up the next day, I was in burnout. I had absolutely no way to really function in this world. It just seemed like I was just floating around kind of lifelessly. But then over the next several months, I was able to go through a lot, but also find myself into outpatient therapy, which really helped me sort through a lot of this stuff, and really helped me get to a place of stability and safety. And so, yeah, one of the things, though, that was really important was for me giving myself grace through a lot of this. This stuff is very challenging, but ultimately it was either to take what was happening and, let it become something that defeats me, or to take it as a understanding of myself and use it to move forward. And so that's what I decided to do, was give myself some grace and choose to use these things as a way to move forward with growth by now knowing what was the thing. What's my birthday? My birthday is in late June. Yeah. Yep. That is my sign. No, it's Cancer. Although I don't know any of that stuff, so I don't know if I'm like painting myself out to be a big picture. Yeah. So you are just very water. That's not a diagnosis. What are you talking about? I think labels keep people stuck. I think a lot of times, yeah, they definitely can do that, because people will say, let's say you get a diagnosis, right? And it's a label like this, a lot of people can get stuck. For me, the things that it was labeling were things that I was kind of already aware of. And that's one of the things that I realized a little bit later on, as I kind of was diving more into it. It was like, wait, these things that are attached to ADHD, I've known about this stuff, and I tried to fix it and failed many times. But now that I know it's ADHD, like, it's like, oh, well, I wasn't going to be able to fix it on my own anyway, and the thing was that trying to fix it on my own without knowing what it was really, really tore me down, and I beat myself up because I tried to address these things like focusing or being distracted, I tried to focus on this stuff for a very, very long time. And every time I tried to address it, I failed. I couldn't get anywhere. And so I just took it as a loss, took it as one of my failures. Um, but, the thing is that when I was able to identify that it was those things, I gave myself so much grace, because that's really when I was able to identify that those things weren't me. Those failures that I've had all throughout my life weren't just me being stupid or failing. Like, it was me up against something I had no idea what it was. And getting these labels actually freed me so much, because I was finally able to attribute so many things that I struggled with, that I tried to fix, to finally something that had a label, that now I could utilize that label to figure out what kind of things do I need to do to better myself because of this. And so, having the labels for me saved me, because it allowed me to be able to go and research, skills-based therapies, and getting onto TikTok and looking at ADHD, and how do people cope with things, how do people deal with this stuff, because medication doesn't work for me. I've tried all of it and it's not really working that well, if at all. So having the labels is really important for me, because I gotta rely very heavily on skills. But yeah, labels do keep people stuck at times, but it's really what you do with them, you know. But yeah, and that's the thing too, is that they're not really labels. So ADHD is a collection of traits, right? Autism, same thing, collection of traits. It's a simpler way of saying, hey, I'm dealing with this thing that is a little bit more prominent in people, or in certain people. These collection of traits exist, and so yeah, I mean, the thing is that really what they are for me is a lot more self-awareness. um, and really it's, how the person decides to take it, how the person decides to accept it, is really what's going to make or break what happens with it. But yeah, I'm in Southern California. um, it's all white, thank you. Let's see. My brother went through the same thing in 2019. It's still bad for him though. Yeah. These things can be really rough. He has BPD, ODD, PDA, autism, depression, severe anxiety. Yeah, here's the thing, is that a lot of this, like, honestly, all those things can be just autism. And I'm not like a doctor, of course, but look at it this way. Um, Having autism, having no diagnosis this whole time, no understanding this whole time, and then going through it later on, autism, creates an emotional dysregulation, right? Especially the undiagnosed part, because you don't really have the whole story, you don't have the whole context, and that's what autism people like, is context. And so you don't even have context with what's happening within yourself. That can create some emotional dysregulation. There's your BPD right there. The I can't even say the ODD part, but basically, ODD and PDA, those are all big parts of autism as well. Demand avoidance, and and a lot of that stuff. And then when you look at the depression and anxiety, think about the fact that anxiety is knowing that there's something wrong, not knowing what it is, and trying to figure it out. And then the depression being constantly failing because you don't know what it is and you don't know how to take care of it. So a lot of these things at the end of it can be just better understandings of yourself. But when you have like a big list, it doesn't necessarily mean it's a bunch of things. A lot of times what it is it's one thing with a bunch of symptoms, so yeah. could this be environmentally triggered by our DNA? I see those as like two opposing things, environment and genetic. I guess if we're talking about environmental, it could be that my mother and my father were too close to each other and then created me. Then that would be an environmentally triggered part of why I have what I have. Let's see. We went through a severe family tragedy in 2019 and he hasn't been able to work since. Yeah. So I would just say, like, look into like an autism coach or something, because that may really, really help. What's ADHD? That's autism and ADHD combined, which is pretty common for a lot of people who are autistic to also have ADHD, and for a lot of people who have ADHD to also have autism. And if they're not aware, a lot of times it's just low support needs autism. But yeah, they're really just like a hop skip from each other, because they share a lot of the similarities and a lot of things that kind of bleed over. And honestly, I feel like at some point I think the reason why they're even separate too right now is because the full understanding of autism isn't even really known yet. The criteria for that keeps changing and evolving, and the spectrum keeps expanding to include other things. So appreciate it. Thank you. Of course, Miss Rockabetti. Appreciate you coming in. Yeah, I went my whole life not knowing, so I guess I can pretend nothing wrong with me now. Wait, hold on. My husband doesn't like when I come into these chats and I hyper focus, and he wants me to just go on living like I'm fine. Yeah, that's I went my whole life not knowing. I guess I could pretend that's not supportive. My husband doesn't treat me differently or let me use that as an excuse. Does he let you have an understanding of yourself though? Does he let you be your authentic self? Because that's an important part too. I was unfortunately, I'm going through a divorce for many, many reasons, but one part of it was that she also just didn't want to accept that this is me. She kept telling me I like the old you or who you used to be, and that was very hard to hear, but also very invalidating of me and my existence. You need support. You need to be able to feel accepted, especially at home. Do people with both autism and ADHD have amplified complications, or are the complications separate? A lot of times there's things that are actually opposites that end up conflicting with ADHD and autism, like the need for structure and the need for I guess the hatred of structure and wanting more like impulsive, sort of unstructured, I guess, doing things on the fly, right? Not planning too far ahead and just going with it. Whereas autism's like, no, I want the structure. I want to know exactly what's going to happen. I need to know every little thing, so I can know what to expect and how to prepare myself for it, so that there aren't surprises and me trying to wonder how I'm going to function, going down all this stuff. Like, there's a lot that then just conflicts, and so they both have to like stop and wait for each other, and yeah, so that's kind of it. Pretty sure my ex broke up with me because I couldn't be normal. That's just that's unfortunate. Really sorry that you're having to go through that. It's also the trash taking itself out, because at the end of the day, you need support for whatever it is that you're going through, right? Whatever it is that you are facing, you need that support. And if it was because you couldn't be a particular way, how are they going to handle you if you ended up having like any other kind of change, right? That would make things differently. You know, I keep thinking for myself things like, you know, what if I would have gotten into a car accident that would have, you know, made my life so much more different, right? What if I became like paralyzed or something, right? Or became like a paraplegic or a quadriplegic? Would that have been me being too different to where the marriage would have just ended there? You know, um, you know, because it's so easy for people to say for better, for worse, right? Sickness and in health. Um, but it seems like even then there are limits for some people, right? And that's for them though. For you, you deserve acceptance and love and all those things. You also deserve to be able to be your authentic self and as much of you as you can be, not as much of you that everyone else thinks that you are. You know, um, and I often wonder, like, yeah, you know, this definitely got in the way, but if it was something else, would it have happened? And then would she have been like either staying in a relationship that she was miserable in, or would she have just left? You know, um, because you need people who are going to be supportive of you through anything. You know, anything and everything that you go through. That's just life, right? You need that. And so I try not to beat myself up over it too much, because honestly, whoever is there needs to be able to handle me. Not that I'm like a lot, just handle my authentic self. You know, my quirkiness, how I take things literal too much. Try not to, but I do. You know, how I need things a little quieter. You know, um, you know how I'm gonna be forgetful. You know, just be patient with me and know that I'm not doing that on purpose. You know, and I'm trying. You know, like those are the kinds of things that you need. Is just somebody who has an understanding of you. You know, yeah, it's a little bit more complicated, but you know, you would think somebody who has all these things, it would be a little complicated, you know. But yeah, it's annoying having it, absolutely. But at the same time, it's annoying not being accepted at a baseline, right? Miss Marvel, how's it going? Um, I often worry too much with BPD. Yeah, I mean, I definitely know that on the emotional side, I can be a lot. Um, but yeah, again, thankfully, I've had a lot of that under control. But even before that, yeah, you know, you know, yeah. I wonder if it's our Christian upbringing. For someone I love, I wouldn't abandon them if they're sick. Um, I mean, I don't think it's tied to any specific type of religion or whatever, but definitely does. Ah, hold on. Puzzle piece. It gets really loud in my ears whenever there's a puzzle piece, so it throws me off. It's not showing me the puzzle, and the countdown is happening. Oh great. It's not letting me do the puzzle piece. So if that does happen, the live may be ending shortly, because it's going to end it automatically if I cannot do the puzzle piece. So I'm going to wait for it to load and just keep talking. I don't think it's religious based specifically. I think it's more just, you know, I did really believe that, you know, it would go a particular way and it just didn't. So expectations were just not met, you know. Um, you I wonder if the ADHD comes out of the CPTSD. No, the CPTSD is, you know, something that that happened to me, right? Um, and the autism is a neurotype, so it's those two things are different. What sucks is when you have both of them, because you know how um, autistic people take in the world and our understanding of a lot of that stuff, it makes it so much more confusing when we do experience trauma. ADHD, thank you for the heart me. Miss Marvel, thank you for the heart me. And yeah, we have a countdown going on right now because, well, let me show you. Actually, I don't even know if I can. I can't. But it says 3 minutes and 16 seconds, and that's when my live will end because it's not showing me the puzzle piece. I'm trying to do the puzzle piece. It keeps saying network error under it in like red text. Yeah. So let me show you all so you understand what I'm dealing with here. I'm using the TikTok Studio. That's basically it right there. Puzzle piece, network error, and then if I were to go and try and refresh it, it just does the same thing. So not sure if we're going to be able to be live here in the next minute or so. See? That's a bummer, ain't it? Thank you for the cap, ADHD and me. So yeah, TikTok is society right now trying to shut me up. Not really, but it is a bummer. You have to do a puzzle to do a live. No, so it's like a CAPTCHA, right? You know, to check that I'm still here and all that. So it has you do a test, basically sliding this thing over to where it fits. A simple like test thing. And yeah, right now it's just not wanting to do that. It's quite a bummer. I should be doing a screen recording. Windows. Oh wait, no. Snipping tool is, I think, the one. I need to get an agency. Let me see here. There we go. Start. All right, it's recording it now. So, oh, is it gonna work? I don't know if it's gonna work. It did something different, but I don't know. Nope. Thank you for the heart me, David, and everyone. Quick restart and go live again. Yeah, I may do that. I may do that. If I do disconnect here in the next 47 seconds, then yeah, I'll definitely do that. And if you come back and I'm not here, it's because I took a quick restroom break. You know, but yeah, it's not letting it do it. It's gonna come down to like at 5 seconds, it's gonna show me, and then I'm not gonna get it done quick enough, and it's gonna be like putting it all on me, you know. But yeah, so 20 seconds, and then I'm gonna get disconnected, and then I'll hop back on the live. You wouldn't let the puzzle timer stop? Well, I can't do anything else outside of it. It's not letting me, you know. I guess I could try and go live on my phone, but 8 seconds, 7, 6, 5. I'll be back, guys. Am I still here? Or did it disconnect me? Am I still here? Because the timer went out. And it disappeared. Okay, so that's really messed up. 5 minutes of anxiety brought to you by TikTok, telling you you have this much time, this much time. Oh, you can't do the thing that you need to do to stay on. Ha ha ha. Oh. do this again. Alicia, welcome in. Where did my straw go? I lost my straw. I guess it did end up kicking me out. Just a little delayed. Who would have thought that? The TikTok software just being buggy. Couldn't even kick me out the right way at the right time. Oh good, what happened? It just shut me off. I laughed so hard when the stream dropped because it's like, yeah, I'm sure it was during my rant. TikTok was probably like, no, don't talk about that. Don't talk about that. I wasn't saying anything anti-American, right? Because I think they control that now too. It mocked me. It let you think you were staying, then cut me off. Yeah, now I gotta put my robe back on because TikTok got me all worked up now. Woke up earlier and said hi and fell back to sleep. Woke up and it went off. I was like, okay. Yeah, TikTok showed me a puzzle piece. Wouldn't let me do it because it wasn't show the puzzle piece. It just showed me the timer counting down. It was like one of those movies waiting to like, which wire do I cut? And yeah, wasn't able to cut any of the wires. But then it let me believe I survived, only to then drop me at that point. Come on. Move some of this stuff around a little bit here. Yeah, I can't say those words though on here. Yeah, it was literally hiding the one puzzle piece I needed. So, what are you gonna do? You know. But hey, this gives me an opportunity to restart the live. You know, which then puts it back onto the, you know, FYP for a short period of time. So, best thing for me to do at that point is to just talk about what I went through. So, I'll spend a couple minutes doing that. But yeah, what part of what I should go through should I talk about? Oh, I'll talk about the PTSD part, but I'll do non-triggering. Okay. So yeah, when I first realized I had trauma, I was doing an ASMR test, which is really silly. I know it sounds silly, but when you're so far into trying to figure out what's going on with your cognitive function, you know, you'll really do anything. And for me, it was finally leading me to this point of thinking I had ADHD. And there was this test that said, hey, if you take this and you're undiagnosed, you know what, you'll be able to focus momentarily. And so I did that and it worked. But the first thing I remembered was something that my mom told me as a child, that all kids shake, which didn't really make sense to me. But then I quickly realized, oh wait, there was this thing in the 80s where all these kids were having tremors and they were shaking all the time, but then they would grow out of it. And so I texted my siblings like, hey, you guys remember in the 80s when this thing would happen? And they were like, what are you talking about? And so then I realized, oh crap, wait, that's not true, because I would have read about it somewhere or something, did a quick Google search. I'm like, no, that never happened. Why would my mom tell me that? And it was something that like I truly remembered. It was just something that was filed away. And so I started thinking about, why would my mom tell me this if it wasn't true? And I started stressing myself out, thinking that, you know, my nervous system was getting overwhelmed just trying to process this. And I started experiencing some physical body pains that I didn't know I had at the time, but are now diagnosed now as a condition called piriformis. But it resulted in pain, a very familiar pain, that then my brain said, get the hell out of there. You don't know what's about to happen. Get the hell out of there. And, you know, knew I was fine. I was in this room, I'm fine. Everything's cool. I have nothing to fear right now. But I'm feeling this sense of fear. And then I had tons of repressed memories come back at that moment of tons and tons of like really, really dark stuff, right? Really bad things. And, you know, one of the things that I remembered was that I would convulse as a kid. I would have these tremors. And I was like, no, that was me. She was telling me that every kid shakes because I was shaking. And 9 months prior to this night happening, I had an event take place where my body was shaking uncontrollably and I had no idea why. It was essentially tremors or seizure, but without actually seizing. I was shaking and I couldn't control any of this. It was happening whenever I would loosen up. And so that started happening again during when I was having these repressed memories come back. I started shaking and everything while the memories were coming there. And the shaking ended up being functional neurological disorder, which is a trauma response. You know, I got that diagnosis about 2 months ago. And yeah, there was a big cover up of basically my childhood that was taking place and a lot of really, really dark things that were happening then at that point as well. And then when I woke up the next day, I was burnt out. But that's what kind of showed all these other symptoms. Basically, my executive functioning went away, and I was just kind of like there with all this stress and no way to cope. So it was a very, very challenging time, especially to just realize that I had CPTSD. I knew about my childhood. I knew what had happened, and I kind of just equated it to normal family stuff, right? I just didn't realize how dark it was. And it was because as a child, I learned to dissociate. I blacked out a lot of times. And that was during the really, really dark stuff. And so, you know, that put a lot of stress into my body. And especially since I dissociated, my brain was safe, but my body was still enduring what it endured. And so my nervous system was responding to this out of pure terror, knowing that it couldn't trust my brain because my brain would just shut off and leave my body hanging. It was a really challenging thing to kind of come to terms with, because then and even now, my mind and my body are still at odds with each other, not really truly believing that I'm safe, you know? And so, but it was a good, you know, since then I've had a lot of really great therapy that has helped out, a lot of good things that have helped me kind of come to terms with stuff, and a lot of good realizations and a lot of learning about myself. And yeah, so since then things have definitely gotten better. But it's something that couldn't have come at the worst time, you know? And so, yeah, having to deal with all of it at once, CPTSD ended up being the primary thing that I needed to deal with before I dealt with anything else, because it was taking full charge. Because shortly after I found all this stuff out, about a month and a half later, my childhood trauma came back to me in a way in which I was re-traumatized. And so I was put into fight or flight, and I stayed in fight or flight. I'm still in kind of fight or flight, but didn't really even get slightly out of it until a couple months ago. So yeah, a lot of challenging stuff that's come from it, but a lot of understanding too that I've come from going through all of it. So yeah, there you go. Hey Blob, how's it going? Morrison Hurst, thinking about having ADHD and whatnot. Like, having it takes away time from doing other things. It can. If you can learn to manage it and work with your brain, you can get a lot of that time back. If you can do things to help yourself, like for me, learning to do things like make notes. That gives me back a lot of time as well. Um, yeah, Joe. So speaking of, I'm getting chills all over my back and then arms, and it goes back and forth like that. I'm sorry. And also in bed under covers, yeah, just keep the wind off of your skin. Try and calm your brain, And yeah, it sucks. How are you, Blob? I'm doing good. CPTSD hides so much. It does. But, here's the thing, like, I am grateful for my dissociation that I developed through, that trauma, because the things that I had to experience as a child, especially at a young age, like starting at 3 years old, I should not have experienced any of that stuff, any of those emotions for a long time, a lot later than 3 years old. But I wasn't given that, and instead I had a lot of confusing things happen. And the fact that I was able to shut down my brain from having to have a 3-year-old experience that and allow me 40 years later to then experience it, I think was the right choice for my brain to make. Because at 43, I could definitely handle it and understand it so much more than when I was a child. And so, I do like my dissociation. I feel like it helped me as a kid. Now, I can still dissociate now as an adult. Finding out what my dissociation was quite the challenge, but also eye-opening, because I always knew it was there. I just didn't know what it was called. And so it really did help me out a lot, to be able to do that. But at the same time, I'm just glad that my brain was there for me at a time when no one in the world was, when the only people that were there to love me were the ones hurting me, right? And so I'm grateful for my brain being able to do that for me. Hey, I'm good. Sister has shown me around at her work, then went to some shops and eating lunch. Awesome, Blob. Sounds like a really fun time. I'm so glad that you're having fun. But yeah, so that's that. And yeah, I was live. I've been live since for the last hour and a half ish. But TikTok wouldn't let me do the puzzle piece, and so we just had a slow timer countdown until I thought everything was fine, and then 15 seconds later, then booted me. But yeah. 2:04 p.m. Anne, did you sleep good last night, Anne? I'm probably not going to be on for too much longer, though. I didn't have any dissociation. I know I was present for all of it, but I have memory holes now. No, so have you heard, Mama Rex, have you heard me explain what my dissociation is? Because you don't know you have it until you know you have it, right? And then when you're able to identify. So it may be something similar, maybe not, I didn't think I dissociated until I realized what dissociation was, like from somebody who suffers with dissociation identity disorder. When I asked them what dissociation was like and they explained it, I was like, oh crap, I do dissociate. Slept for a good 12 hours. I'm so grateful for you, Anne. How are you feeling? How are you feeling after all that sleep? Yeah. Have I been up to anything interesting? I know you have some things you got to do soon, but you're doing okay. I'm doing okay, I guess. 1 week from today is the court date. And it's going to be a challenging next week. One day at a time. Even though it's only a week away, still one day at a time. It's not today. I think the meds are starting to work. That's awesome, man. Really appreciate that. I feel like the stream helps me correlate a little bit, co-regulate a little bit. Good, good. I mean, sometimes even just knowing that other people are going through similar things, you know, is the best thing for you. Yeah, I've had dissociation in adulthood. I remember the bad stuff as a kid, not the good. Um, the bad stuff is easier to remember because it's traumatic. It creates a big imprint on your brain. You know, I don't remember much from my childhood except for all the bad. A lot of that is because, well, I mean, who remembers a lot of their childhood anyway? Something significant had to have happened for me to remember it, right? So you remember certain holidays, you remember maybe certain birthdays, certain birthday parties you were at, different kinds of stuff, you know, because they're significant. Trauma definitely is a significant part, and when you experience a lot of it, it drowns out all the good, you know. Thank you, Anne. I know everyone's here for me. Divorce is terrible. You know, even as the one who petitioned for it and filed the paperwork and had the paperwork served, it still sucks. You know, you're taking a bond and you're ripping it apart, you know. And I'm a very, you know, I'm emotionally tuned in, you know, so it makes it even harder for me because I feel the realness of these things being torn. I'm actually feeling better, coughing a lot less, but actually feeling hungry for once. That's great. It's great, and I'm really happy for you. If hard choices were easy, everyone would make them. I don't believe in labels. It's just trauma. It can all be healed. Trauma didn't cause my dyslexia or my autism or my ADHD. And people don't go through, you know, not everyone who has autism. I mean, I was born with autism. It showed a lot of the traits well before any of the abuse started to happen. So, yeah, it's, you can definitely believe that, but it can be proven false by many experiences that are out there. I definitely think that trauma can create a lot of things, but it can't create a different neurotype, you know, because those are things that you're born with. Yesterday I had to force myself to eat as I hadn't. I'm glad that you did force yourself to eat, though, you know. Generational trauma isn't passed at birth. That's not what generational trauma is. Generational trauma is being raised a particular way with a particular type of family system, a particular type of way of families doing things, and passing that on when you become a kid to the way that you parent your kids and the way that you do things with your kids. Breaking generational trauma is what I'm doing, which is I was treated this way as a kid, and I'm not going to treat my kids this way. So yeah, no. I mean, I understand that that's your perspective, but it's also a perspective that may apply to you, but doesn't apply to a lot of other people, you know. I have read Gabor Mate, but it's not genetic, it's behavioral. And you don't pass behaviors down through birth, you know, because it's not genetics, you know. So yeah. Hey, me too. I just turned 49 and I was officially diagnosed with ADHD 2 years ago. Welcome in, Christopher. You know, generational trauma is a BS excuse for people who won't break the cycle. Mama Rex coming in here with some truths. Because Because, yeah, take accountability for yourself, you know? Is this proven by studies that you've done, or is this proven by like a Google search to look for things that, you know, you feel are theories that you then search for to try and find a, you know, study that may represent it? Because it could be that way, I guess, you know, in some certain instances of certain types of things, but maybe not the type of trauma that you and I are, no, that we're talking about here. Because also my, yeah, my parents weren't treated this way. You want to know how generational trauma starts? Generational trauma starts when your parents pick up a book called The Strong-Willed Child by James Dobson, and then they actively decide, this is how we're going to raise our kids, by the things based in this book. And when those things based in that book cause kids to go through trauma, you know, that's not this, that book wasn't given to my parents when any one of us was born, you know. It wasn't. Yeah, James, the guy who doesn't deserve to have the doctor in front of his name. That's not generational trauma. That was the generation of my parents deciding that they found a good way to control their kids by taking away their will by this person who has the same beliefs they do. That's not generational trauma that was given through genetics. That's generational trauma that my parents purposely picked up and said, all right, we're going to give this to our kids. So I don't know about you, but they weren't given this book at the hospital. I wasn't born with this book duct taped to me as a baby. You know, so I would say that the view that you have of how trauma is passed down isn't genetic, because I've also actively chosen to not do that to my kids who hold my genetics, who don't have the same things I do. They don't have trauma because I made a conscious decision to not do what my parents did. Because sometimes you just know when something's bad. And I knew something was bad. That's why I do not have a relationship with my parents. They will never know their grandchildren. As soon as I had my CPTSD, my mom has not seen my kids since then. Granted, she hasn't been around. My dad's already passed. But I think it's because she knows, because I started asking questions about things, and she started lying about some of the stuff, and I just dropped it. She hasn't called me since, you know. It's a pretty big tell. That's why I don't have kids. My parents ruined that for me. Yeah. See, the thing is that also comes with a lot of pain, you know, you know, and a lot of I don't know, a lot of suffering. But the thing is that, yeah, not generational. Farah, thank you for the heart me. Let's see. Yeah, that person leave because they ain't replying anymore. I'm very curious. I mean, it's good for them to open their minds, right? To be open to different perspectives, right? I mean, I do believe I'm trying to pin a comment, but it says it's under review. Oh, there it is. It's good to open your mind and consider different views, right? I do believe that. What do I dislike about that book? Let me find a way to respond to that that's not triggering, because of what it is. Okay, so I'm going to have ChatGPT help me out. As a undiagnosed autistic, and this is how you guys need to be using ChatGPT with complex queries. Wait, let me do this again. What can you explain briefly how following the principles taught in the strong-willed child because yeah, it can explain how the principles taught in the strong-willed child would affect children, and then also how they would affect undiagnosed autistic and ADHD children in a very generalized, non-triggering way. Yeah, you should be scared of ChatGPT. All right, so in general, the strong-willed child teaches very traditional authoritarian parenting principles. And again, very generalized. The focus is on strict discipline, obedience, and breaking down resistance in kids. In general, the following these principles often leads to compliance in the short term. Kids learn to follow rules quickly. Less emotional safety. Kids may feel more fear than trust. Long-term mixed results. Some people become very rule following. Others rebel strongly as they get older. Okay, so that's just common. Okay. For kids with undiagnosed ADHD and autism, when applied to neurodivergent kids without an understanding of their needs, the effects can be magnified. ADHD. Instead of learning better focus or self-control, they may just feel bad or lazy because the discipline doesn't change how their brains work. This can increase shame and lower self-esteem. Autism. Since autistic kids often struggle with sensory overload and social differences, harsh discipline can feel overwhelming or even traumatic because their non-compliance may come from inability rather than defiance. So the super generalized summary: most kids, obedience with possible fear shame trade-off. For autistic kids, risk of shame, frustration, and feeling misunderstood. That was ADHD kids. And autistic kids, risk of emotional harm, higher anxiety, and less trust in adults. That's very generalized. If you want to ask ChatGPT for a little more, go and do it, because it'll get into more details of what specifically it means, but it's going to be triggering. Okay, the way in which they do this and how they do this, especially the frequency of doing it, is very, very, very terrible. And my parents took this and they ran with it and kind of kicked it up a notch or 2 or 3 or 100. So yeah, you learn so much stuff too that you have to unlearn. I've had to unlearn what love is in the last year. Was I raised in religion? Yeah, I was raised in a cult. Basically seemed like a cult. I'm pretty sure it's a cult. My older brother believes it's a cult, but it was disguised as basically just fundamental Christianity. But it was very cult-like, you know, because there were elders who you had to answer to when you misbehaved, things like that, you know. And you know, nobody's allowed to have TVs or talk to other people or socialize outside of people who didn't go to that particular church. There's other kinds of trauma that doesn't have to do with that book, that has to do with just how my parents chose to seek their spirituality. So yeah, that's not generational through utero. You know, yeah. So that's why politics is triggering, because it follows the same authoritarian abuse. Yeah. And actually, to be honest with you, this book, if you were to look into, well, let me even ask, what's the political motives behind this book? All right. So this is what ChatGPT says to me. Again, completely not being the one who was traumatized. It says, good question. You're right to look at the politics, because The Strong-Willed Child wasn't just a parenting manual. It was part of a larger movement. Here's a clear, non-triggering overview. Political roots. James Dobson, the author, was not only a psychologist, but also a major leader in the American religious right and founder of Focus on the Family. The book wasn't just about raising kids. It was about promoting a worldview. Obedience to authority, traditional gender family roles, and discipline as a moral necessity. Okay? And then the political motives. Cultural conservatism. It enforced the idea that strong, unquestioned authority in the home would lead to strong, obedient society. Religious influence in politics. It gave conservative Christian families a model of parenting that aligned with the broader agenda of the moral majority and the rise of the evangelical political power of the late 20th century. Anti-countercultural response, with written during and after the social changes of the 60s, 70s, civil rights, feminism, new approach to psychology education. It pushed back against those movements by promoting discipline over permissiveness. And then political unity. By shaping family dynamics around obedience and hierarchy, it indirectly supported political structures favoring authority, tradition, and resistance to social progress movements. And I would encourage you guys to look into the moral majority as well. There's a lot of stuff that just got messed up, you know? And then there's a generation of people who just will not talk to their parents now, you know? Yeah. The satanic panic, you mean that the devil's everywhere? Oh yeah. Everything was the devil, Satan praying over somebody to get those demons out, all that stuff. You know, purity culture, true love waits, all that stuff. Yeah. How many of you signed the purity pledge? And then how many of you went back on that, like, so hard as soon as you could? And yeah, so, I mean, here's the thing though, like, you know, yeah, but here's the thing. I don't want to go make something to eat. Have a good day. Live. Yeah. The live will probably be over pretty soon. I am so sorry, Laura Enigma. I'm so sorry. You should not have had to go through that. You know, the thing is that this really set up people, like, the long-term effects they were not thinking about, because it did work in taking away my will as a child. Then I grew to have a very unhealthy relationship with my parents as an adult. One that never questioned them for doing this. One that relied on them heavily for a lot. And even when I tried to break away, was left kind of feeling like I was dependent on them, because I always needed them, because I never learned autonomy. I never had any kind of agency. I was never enabled with anything. I was always looking to them for everything. And so a lot of what I'm doing now is having to reparent my inner child. You know, reparent myself and say, you know what, my parents, they had their chance. I'm starting all over. I'm going back to my inner child and I'm changing everything. And so through these books, through my parents, all that other stuff, I've really just kind of pushed it away. It's no longer relevant to me. It's relevant to the story, but it's no longer relevant to me. What matters to me now is going back to my inner child and saying, no, it's okay to stick up for yourself. It's okay to speak and advocate for yourself. No, not everything is your fault. Not everything is going to be because you're bad. No, you don't have to fear being in your home. You don't have to always watch your back. Going through and just continuously saying all these things to myself and finding more and more things to assure myself the things that I learned as a kid through this person and through their thoughts and ideas. It doesn't have to be my childhood. It doesn't have to be what my inner child is founded on. And it's a lot of work, and I've been able to do a lot of make a lot of progress on a lot of this stuff, but it's going to take a very long time. All these girl illnesses, just man up. Man, girl illnesses. Does that mean like I'm going to become a girl? Or maybe I am one, I don't know. I don't think I am, but yeah. Bye, Blob. Take care. Have a good time with your sister. Hello, my ladies. Are you tipping your fedora when you say that? That's how I'm picturing it. But yeah, I haven't done EMDR. No, I've been through the beginning process of the EMDR yet, but I haven't actually started doing it yet. But yeah. But see, here's the thing. I have, it's easy to be triggered by Christians. Yeah, I get that. And the sad thing is that we're seeing a lot of the results of things like this now, in politics and, essentially the moral majority, Dr. James Dobson, all that stuff. Fast forward to now, you have MAGA, okay? But it's important to note that not everyone who's spiritual and believes the things that Christians do are going to be that same way. A lot of people can think for themselves, and, we can have our thoughts and views and our judgments on everything, but it would also be improper and incorrect for us to say everyone is like this, because not everyone is. Not everyone had to make these choices and get themselves like caught into this web. And some people really did, enjoy. Enjoy what? I'm getting distracted by people trying to troll. Yeah. Yeah. That's a good one, Mama Rex. Not everyone is like that, so we have to give a lot of people. Because look, like even now you're seeing a lot of people breaking away from MAGA who are Christians who know Jesus wasn't like that, right? And that's the thing is like, so, I'm definitely not religious, and have really deconstructed from that a lot. I have a lot of knowledge of the Bible, though, a significant amount of knowledge. And I know a lot about the teachings of Jesus, and it's nothing like the people who follow Jesus act. Okay? And like opposites in quite almost every regard, right? Jesus the healer, but then we can't have universal health care, right? Jesus feeds the 5,000, feeds people, but we can't have welfare, right? They're freeloaders, right? Jesus spends time with the poor and the marginalized, and the needy, and the oppressed. And we're deporting people. We're trying to, make it really only about the people who are not lazy, who contribute, um, there's so much that I see that doesn't equate with the idea of what Christianity is and how Christians are. They do not mix. They don't, you know? And so, yeah, he would be on Jesus would not be accepted. Mommy pastry's awesome. But yeah, so that's the reason why I say not all of them are like that, because there are people out there who are progressive who do have their faith, which is great. Going to join Discord, awesome. Anyone can join the Discord actually. Go to timadhd.com, or you can go to the link in my bio and you can get in through there. But yeah, I'm gonna have to get going here shortly. Yeah, I don't always talk about this stuff specifically. I don't really like to get too much into this part. Really, it was brought up mainly because that person said that generational trauma is passed on at birth. You can't hear. Tim, can I tell you a fun fact? You know a word in Welsh? I do. What is that word? But yeah, so that person, of course, saying that it was passed down at birth. Now I had to kind of show mine wasn't passed down at birth. So yeah. Mom in Welsh is for mom. Well, hey, ma'am or mom. How do you? I don't know. You'll have to tell me the exact A that I'm looking for. First one, ma'am, mom. Which one? First one or second one? First one. Okay, ma'am. Well, there you go. I know a word in Welsh. I'm actually part Welsh. I guess. I don't know. My parents did feed me a lot of lies, so who knows? But I do appreciate Tad is dad. Awesome. I'm learning more and more, and you teach me things every day, and I appreciate that. All right. I feel so validated because I didn't know many were open about their religious trauma. I'm open, but like I said, maybe we can create a separate Discord channel to discuss that kind of stuff, so that people can. It's very triggering. Very, very, very triggering. Baby, look into for those of you who have dealt with specifically that book and everything, look into the podcast called Strong Willed. It's by therapists who grew up in that environment, and they talk about the effects of that stuff. It's a really good podcast. There's also one that's called Show This to Your Therapist, or an episode called Show This to Your Therapist from Strong Willed. It's a two-parter. Listen to both parts. You'll have a much better understanding of how this impacts people, how it's impacted people, and a lot that you'll be able to relate to, especially if you feel like you're not being validated. There's a lot more out there than what I can explain. I can only explain my experience. But yeah, so look into that if any of you have been subjected to that type of authoritarian parenting, especially through that book. They'll just show this here. Yeah, Strong Willed is the podcast. Baby, if you want to DM me, just DM me and ask me what for the podcast on the Strong Willed Child, and I'll send you everything over. But yeah, it's definitely the podcast is called Strong Willed, maybe hyphenated. And yeah, the specific episodes that you could look at is the one that's like Show This to Your Therapist. I believe it was around August of last year. The Discord link won't work for you, so that happens for a lot of people. So try looking at it at timadhd.com. You may also be able, like if you go to the website and then do it there, because TikTok for some reason, yeah, it'll do something weird. But yeah, open a new window, do all those kind. Like there's just, I don't know why Discord's being weird with it or TikTok's being weird with it. I don't know which one of them, but give that a shot. And if you do have any issues, just send me a message or DM me your Discord username, and then I'll add you and invite you. But yeah, I'm gonna go ahead and go. I have outpatient therapy today. And yeah, like I said, I don't really talk too much about the religious trauma stuff because it can be very triggering for a lot of people. But in the Discord, I'll try and create something that people can ignore if they want to. No apologies. Okay, I want to find a way for us to be able to all communicate and help each other out, and sometimes it's even working through common trauma, and sometimes when it's something that is done this way, information actually helps. Thinking about it more actually helps, which is odd because it's more just confusing until you realize, where did my parents come up with these ideas? Then things start to make sense, because otherwise it's just your parents are terrible. I don't want to believe that my parents were just terrible. I do want to believe that they were misguided, and yeah, definitely need to hold accountability for themselves, but it's not like they desired to just have kids to torture them. I don't want to believe that, although my childhood was basically torture. And the bitter part in me could just accept that. But the rational side of me does not want to just accept that. I want to know either they were brainwashed. Yeah. Like, I want to know the actual logistics of what went through their head. Now, does that mean I give them a lot of grace now? Hell no. They have no grace with me. But for myself, I don't want to believe that I was just destined and doomed to be raised by people who were there to torture me. Because then that just brings me more feelings of helplessness. And I could really use a break on that helplessness. Yeah. Bye, and all right. I'm going to go ahead and head off. Thank you, everyone, for joining. For those of you who don't know, I go live 6 a.m. every day. And yeah, Pacific time. So feel free to join again. And then I also have a Discord. If you have trouble accessing it, go to the website instead, and that will really help. Don't forget to drink your water, like Trisha said. Because water is very vital. But take care, everyone. Thank you for allowing this to be a safe space too, and for being open and allowing the trolls to be here so that we can show them that their view is not always accurate. Trish, thank you for the heart me and the roses. I appreciate all of you. Coffee is flavored water. Absolutely. As long as there's water in it, right? Did I make my water goal yesterday? No, but I did drink a lot of water. All right. I appreciate all of you. Thank you all for joining. I will see you all next time. Take care and have a wonderful